Our group studied firearm-related mortalities in pediatric patients, and we looked at legislation on the state level that could potentially contribute to higher or lower firearm injuries and firearm mortalities. Particularly, we looked at the Brady scores, which the Brady campaign is an organization that puts together on an annual basis a rating scale essentially for states to describe how strict or how lenient their firearm legislation is in that state. What we found from that is that states that have higher Brady scores or more stringent legislation have lower pediatric firearm mortality rates than states that don't. The other thing we looked at is what are called child access prevention laws. So these are separate laws, separate categories that look at particular laws that are trying to prevent children from accessing firearms. And these include things like safe storage laws and gun lock laws. What we found essentially is that the CAP laws have a similar correlation to pediatric suicide. So in states where they have both types of child access prevention laws, their suicide rates were 4 times lower than states that did not have either of those. It's absolutely important for pediatricians to talk to families about firearms in their home and also in the homes of their friends that they're going to visit. We try and approach it as essentially a public health issue, similar to seatbelts and car seats and things like that. So this really should be something that pediatricians are able to ask about. And most studies show that parents are okay being asked those types of questions. So the recommendation is typically to have the gun stored in a locked safe, to have the gun stored unloaded with the ammunition in a separate container that's also locked.